Welcome to a short presentation on IV insertion steps. The very first step of inserting an IV is called pre-cannulation. The nurse has to go and she has to look at her order for IV fluid. She has to verify that order, and then she needs to wash her hands, identify her patient, find out his name, his date, any allergies. Then she's going to go and she's going to apply the tourniquet to the arm, and she's going to assess for a possible location for IV insertion. I want you to think about this. What are some things that would prevent you from inserting an IV into this arm? Once the nurse has assessed her client's arm, they will remove the tourniquet and prepare their catheter, the tape, and their clear, transparent dressing. The IV cannulas, there are just multiple companies that make them. We have the brand AngioCath in the lab to use on the IV arm. But the one thing that you will find no matter where you go in the United States, the colors are always the same. They color code the catheter size. The sizes go from 14 to 24. 14 is the larger gauge, and 26 is the smallest gauge. Some tidbits for you. A rule of thumb is to choose as small a catheter size as possible to maintain maximum blood flow around the catheter. A small catheter will also minimize the risk of damage to the blood vessel. Always consider your purpose of placing the IV catheter. Assess the patient's blood vessels carefully. Never use a larger catheter size than necessary. Again, they are color-coded. They correlate to a gauge size according to something called the ISO standard. But remember here, the higher gauge size, the smaller the diameter and size of the catheter. The biggest diameter for IV catheters is the 14 gauge, and the smallest is 26 gauge. And that's a bit contradictory, so kind of keep that in mind, and it's a little bit confusing. Now we're up to the second step of IV insertion, which is called cannulation. So the term intravenous cannulation simply means that we're going to take that small plastic tube, the cannula, it has the needle inside, we insert it into the peripheral vein. The subsequent venous access can be used for the administration of fluids, medication, and nutrition. My student opted here to hold our IV arm steady with her non-dominant hand. You can do that. You have to be very careful. I don't want the person to stick themselves as they're inserting the needle into the skin. Most people recommend that you always begin around a 20-degree angle, and once you see the flash of blood, and I will show you what that is on the next slide, you can lower your angle of insertion to about 15 degrees. Remember, be very careful where you put that non-dominant hand. We really don't want you to have a needle stick. What does the term flash or flashback mean? Well, the flashback of blood in this clear plastic chamber indicates that you're in the vein. Once you see the flash, take a real deep breath, get in some oxygen, and then you're going to have to go and you're going to have to snap the plastic cannula loose from the needle. It's right here. It slides off. You're going to have to advance this cannula up here and make it flush with the skin. It's not quite flush with the skin here in the photo. And once you are flush with the skin, you go back here and you're going to hit your safety retraction needle. The needle will come out of the plastic and go back up into here. So you are not going to have a needle injury or a needle stick while you are inserting the IV. Right here in the photo, you can see that this nurse has retracted the needle into the safety canister, and he has the IV cannula inserted, and they are ready to attach the IV tubing. Here you can see where the nurse attached her tubing to her IV cannula. After she did that, she covered the IV insertion site with a clear, transparent dressing. The clear, transparent dressing is to help prevent infection, and because IVs are a huge problem with healthcare-acquired infections. If they're not sterile and maintained properly, they can be a huge source for bacteria. The nurse here was careful not to only cover her IV cannula and not the tubing. Once you have your IV, and you go and you have the flash and you insert the IV, if you look up at your drip chamber, you should see drops coming from the drip chamber, usually pretty fast if you have the IV, if you have all the clamps open on the IV. Here you can see post-cannulation. The IV has been inserted, clear, opsite was applied. The nurse went up and she made it comfortable for the patient's arm. She made like a little loop around and put some tape on. She dated her IV tubing. She also documented where she put the IV, what size cannula that she used, and how the patient tolerated the procedure.